It's the start of a new year and the perfect time to address those unsightly veins you've been hiding. According to the American Venous Forum, roughly 1 in 3 Americans over the age of 45 has some type of vein disease. And while early symptoms may seem minor, they can become more serious and even life-threatening if they're not treated. Dr. Charlie Hahn of Veins, Florida, explains the various vein diseases he treats and how under Medicare your procedure may be covered.
Varicose veins, those are large veins. They tend to be usually running down the leg. Spider veins, those are the tiny veins that just barely underneath the skin, and they tend to be in clusters, like the veins on the leaf. Sclerotherapy is to inject those spider veins with a vein solution. It's a very mild form of irritant. It will get into the vein, irritate the endothelium of the vein, and cause the small vein to collapse and subsequently be absorbed by the body. And we can also use it for slightly larger veins, which will prevent it from bleeding also. That's primarily just injection. I tend to use that for small perforators and for spider veins. For those large varicose veins, we make a tiny little incision and use a special instrument to pull them out. And that can achieve a great success by removing the vein immediately. We can clean up the whole leg within a shorter period of time. And those have minimal bleeding and minimal recovery time. Patients come here, they will have some sedation, which they will not remember or feel any pain during the procedure. And then we have the ultrasound machine, which we localize the vein and access the vein with the ultrasound help. And then the device is very thin, it's like a hair. It will place into the vein and the laser will work. And usually it takes about 5 minutes. And then I will remove the device and perform either injection or clean up the varicose veins with microfluidectomy. And usually it's about 20-30 minutes. And then the patient will have a dressing, wake up from surgery, and they've been watched for about an hour or so, and then they can go home after that. The insurance will cover if a patient has documented episodes of bleeding, even for spider veins. For the varicose veins, the Medicare will cover for large veins that cause pain. We tend to have to get approval with an ultrasound, document the reflux. But if we submit all the information that they require, usually they can be covered by insurance.
You'll find contact information for Veins Florida under the Varicose Veins story icon on our homepage at yourhometownhealth.com.